can come here and see.
Yeah, I want to see that. There's exactly what you do.
Okay, this is how it is done. Place it down gently. Now in case of slip disc, in case of a slip disc, again we have to work on either sides of the spine very gently, because the slip disc could be just a protrusion of the inner bone or any disc. You see the spine has nearly 7 bones interconnecting to make a complete spinal column. So any of those bones can slightly shift out, which can cause a slip disc, or it can jut out a little bit, and that is a slip disc. So when we are doing the therapy and working on the person's back, you have to work on the sides of the back so that the disc can come into alignment. You see, that is how it is. So, and of course, if one has gone through fractures and things like that, you definitely cannot do a thigh massage. I would not even advise any other massage therapy for fractures, because first the fracture has to heal. Once the fracture is healed, only then can you do the therapy. Alright? And other cases, of course, in case of stomach problems, constipation. Now, thigh massage can definitely release constipation, and of course with proper advice. If a person is going through severe constipation and all that for many, many days, I have experienced people who come to me and say, I haven't cleared my bowels in 20 days. I said, what did you do in 20 days if you haven't cleared your bowels at all? And then I have to work on the tummy accordingly and give proper advice wherein the person is able to have the right kind of food in order to release and clear the bowels regularly. Okay? Now in case of smoking, person who is high addict, now the person will go in for a therapy every alternate days to release that addiction. The person can go in even for drinking. A person who is a high drinker can do a therapy every alternate days to release the drinking aspect. And there are various other people who come to me for various addictions. So that all those needs to be released over a period of time. Nothing works immediately. Now in thigh yoga massage, when I say it releases cholesterol, it is not instant. Remember, your cholesterol has developed over a period of time. Like from infancy, almost like since the age of 2, the child starts developing cholesterol with the kind of products the child intakes. And so that many years of cholesterol to release doesn't go off in one sitting. It takes a number of, you have to release all those toxins. And then advise the patient accordingly or the client accordingly on what kind of foods you need to do, or what kind of drinks you need to have before you go in for a therapy to keep yourself clean. Basically, water is the best cleanser. Water, drinking a lot of water is the best cleanser. If you can have hot water, that's something fantastic. Now, after the person has gone through a treatment, I always advise the patient to have a hot glass or a hot cup of green tea. Green tea is excellent once you've gone through a therapy, because we are releasing your toxins. So what the green tea does, once we are releasing a toxin and you have the green tea, it comes out in your urine when you go to the toilet. Okay, so that is what is very important to always advise a patient to have green tea after no other tea, no masala tea or any of these things. If there is no tea available, have normal water. Normal water is very important for the person to have after going through a thigh massage process. Alright? Now, is there anybody suffering from any ailment, like a stomach problem or something like that? But you had a therapy yesterday?
Not yesterday.
Okay.
Last week.
Okay, so can you come here? Is there anybody going through a stomach ailment, like constipation or something like that?
Much of gas and acidity,
burning sensation, gas and acidity. That is another thing that we can release, but the person has to be very prompt with her treatment coming to us. Yes, sir. Since how long have you had this?
It occurs off and on. So, maybe before yesterday I took a medicine to release the substance. So the thing is that
see the treatment is very extensive. It's only on one side, right? Yeah. Anybody going through stiffness of joints? You are. Okay. Are you going through arthritis or something? Can you check the density of the bone?
Yes.
Okay. Now, as a therapist, there are many factors that one would have to consider. First thing, you have to take the history of the patient. All right. In case of, say, bone problems, since when is the person suffering from arthritis, maybe, or rheumatoid arthritis, rheumatism, or whatever? There's a lot of, or even fracture, whatever. And how long has the fracture been since, and like how many years, and how long will it take to heal? You see, and accordingly treat the patient, because if you go bang on treating the patient like that without knowing the actual case history, then you're in for trouble. You may quite damage the person further. Can you bend? Right. Now you feel perfect. Very good. Yeah, but I still need to give you treatment, because although you say this, but we are treating here. At the same time, we are treating this. You get my point? Okay, then there are other treatments involved that will help release her back problem. Okay, how do you feel right now? Better?
Yeah, better.
Yeah. Now, in case of very severe pain, like extreme severe pain where the patient cannot take the therapy at all, you have to go very gentle at first. You cannot give, heart therapy instantly. The patient has to go through it very, very gradually, and then once a lot of the tension or a lot of the pain has released, then you can give a proper therapy. Otherwise, you have to go in stages.
I don't know if I can do it myself.
Or yourself, you will have this. I will show you how to do it first.
Thank
Okay?
you.
Right. Now, let's say for instance, on your back. On your back. On your back. Now, this stomach problem is generally a person going through and has a lot of gases and is not able to release gases, and has terrible burping problems and is very offensive. Okay, take a legs closer. Have you feel the pulse? Okay, right. First, if the patient is not constipated, there is one way that we have to work around the patient, but if the patient is constipated, then there is another way that we have to work around the patient to release the constipation. So she is not constipated. So, okay. There's a lot of breathing exercises involved. That is why, again, Thai yoga massage. The word yoga is constantly involved, put into this therapy. Right? Yeah. Now inhale deeply. Exhale. Inhale deeply. Exhale. Inhale. Exhale. Inhale deeply. Exhale. You're working on the solar plexus. Exhale. Inhale deeply. Exhale. Inhale deeply. Exhale. You're working right down the abdomen. Inhale deeply. This is how you can actually check if a person is going through any problems, say in the kidneys, the liver, the pancreas, spleen, whatever it is. Inhale deeply. In one instance, I was able to gauge that the person is going through appendicitis problem. The person did not even know till I started the therapy on her, and then she said, I'm suddenly getting a lot of pain. So I said, what is the problem? She said, I don't know, I'm just getting pain. Then I did a further therapy to check what the problem was, and I realized she was going through appendicitis. So I said, instantly, immediately take a doctor's advice, go to a doctor, check out what it is. The next day I get a call to say, yes, I do have an appendix problem and there is surgery required. So, doing this therapy really helps. You can actually gauge what the person is going through. Inhale, inhale deeply, exhale. 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 Now this side, when you're doing pancreas and spleen, you may even find out, you can even find out if the person is diabetic when you press the pancreas, because diabetes related to pancreas, that's another story in itself. Okay, inhale deeply, exhale. Inhale deeply, exhale. Inhale deeply, exhale. Inhale deeply, exhale. Like this, you take 2 rounds completely to release the constipation. Alright?
Clockwise or anti-clockwise?
It will depend. Like I said, constipation, one side, non-constipated, the other side. The person is clearing the motion. Right? Then give a gentle therapy to relax the abdomen. Relax. Now, is there anybody going through cholesterol problem? Anybody here with cholesterol problem? Now I'm just showing you how cholesterol is released. Of course, first we work on the chest, right? But the other place, now you all know that we can feel the pulse here. This is one of the areas where pulse can be felt, alright? Pulse can be felt in the groin area, pulse can be felt here in the upper arm, over here, alright, and on the legs. Alright, pulse can be felt also here and on the temples. But where are we going to release cholesterol from? Here. Right? We also release it from the groin area, but that I'm not going to do. I'm going to do it here. Feel the pulse first.
Can you do it on this hand?
Once